My partner and I arrive on scene to a motor vehicle accident. As we exit the vehicle, we don our BSI and make our way up towards the scene of the accident. Upon arrival, the scene is safe, secure, there are no hazards. Make our way over towards the patient. We notice there's no bystanders around to gather any sample history from. I'm gonna have my partner stabilize the head as I get down with the patient. Hey man, are you doing all right? Can you hear me? There's no response at this time. I'm gonna pinch his neck and his shoulder to see if he responds to any pain. He does not at this time. So now we are going to assess his breathing. We're gonna jaw thrust maneuver this time. Look, listen, feel. His breaths are shallow and rapid. So at this point, we are going to insert an OPA and an NPA. And we know his breaths, his breathing is shallow and rapid. So we are going to BVM him with 15 liters of oxygen and about 12 to 20 respirations per minute. So now that we've bagged him, we're gonna move on to circulation. Check his pulse. His pulses are both steady and normal. Strong, steady, and normal. We're now gonna move on to hemorrhaging. No hemorrhaging at this time. We're now going to begin our rapid assessment. I'm going to check the orbits, the nasal bones, the maxilla, the mandible. We're going to check for any tracheal deviation along with any jugular vein distension, which there is none. We're going to check his collar, his clavicle, his scapula, and his shoulder. All appear to be normal. We're going to check his other side. We're going to check his clavicle, his scapula, and his shoulder, both of which appear to be normal. We're now going to check his rib cage, his sternum. We're going to listen to the lungs. Now that we've listened to the lungs, we're going to palpate the abdomen. Now that we have palpated the abdomen, we're going to press in, not on the hips. We're going to check his legs. Check his pedal pulse, cap refill. Hey man, can you push down? Can you pull? Check his other one. Both legs appear to be the same. We have a pedal pulse, cap refill, reacts to pain. Hey man, can you push? Can you pull? All right, we're now gonna move on to the arms. He has a pulse. Cap refill is immediate. Hey man, can you squeeze my hand? He has a pulse. Cap refill is immediate. Hey man, can you squeeze my hand? Now at this time, we're going to begin our primary assessment. We're going to check the orbits, the nasal bones, the maxilla, and the mandible. We're again just going to briefly check to see if there's any tracheal deviation or any jugular vein distension and anything wrong with the spine, which there is not. So at this time, I'm going to have my partner apply a cervical collar to the patient. Now, moving down again, we're going to check his lungs. His lungs are the same. We're now going to roll the patient, log roll the patient. The longboard is here. Check the back for any hemorrhaging, any deformities, anything like that. There are none. So now we are going to lay the patient onto the longboard. We're now going to strap the patient, and now we are going to transport this patient, because at this time this patient is a high priority trauma patient. Now we will move on to the secondary assessment. So now that we have the patient in the truck, we're going to remove the pants, the shirt. He's going to be in his boxers at this time. So we are going to check his orbits, some nasal bones, the maxilla, and the mandible. We're going to briefly move the mask. We're going to see if there's any change in the airway. There's none at this time. There's no vomit, no blood, nothing that has to be suctioned at this time, so we're going to continue. We're going to continue to bag him at this time. I'm going to check to see if there's any tracheal deviation again or any jugular vein distension. There are none. I'm now going to check the clavicle, the shoulder, the scapula, and the shoulder. I'm going to check to see if there's any medical alert tags. I'm going to check the clavicle, the scapula, and the shoulder again. There are none at this time. I'm now going to check his arm again. His arm is normal, his cap refill is good, his pulse is good. Hey man, excuse my hand, still is not squeezing my hand at this time. I know this arm is good, so I'm going to apply a blood pressure cuff to this arm, begin getting vital signs. I'm going to check his other arm again as well. Pulse still there, cap refill is still good. Hey man, can you squeeze my hand? Still not squeezing my hand at this time. I'm now going to check his ribs again. Check his sternum. Now that I've checked his sternum, we're going to listen to the lungs again. The lungs are good. We're going to palpate the abdomen. Again. Check the hips again. We are also going to check the legs again. Check for a pedal pulse. Hey man, can you push, can you pull? His feet are reacting. Check the other leg. Both legs are the same, pedal pulses are still there, cap refills are both still good. Hey man, can you push, can you pull? He's not responding to that. So now I'm going to apply a 12 lead to the patient, and I'm going to continue to monitor vital signs every 5 minutes while we transport. At this time, I'm now going to call for ALS intercept for a medic, and I'm also going to call in a trauma alert to the hospital at this time.